If you've ever gone to the dentist and didn't know how to explain your pain, or you wanted to book an appointment but didn't know the right English words, or maybe the dentist said something and you thought, what does that mean? Then this episode is for you. Today, I'll teach you the exact English you need to talk about tooth pain, explain your problem, book an appointment, and understand what the dentist says during your visit. By the end of this lesson, you'll walk into any dentist's office with confidence and zero confusion. Hello, everyone, and welcome back to the Raland English Podcast. I'm your host, Brandon, and I'm so happy you're here for another super useful English lesson. Today's topic is English at the dentist, something everyone needs at some point. Whether you're going for a checkup, cleaning, or because something hurts, you need the right English to explain your problem clearly. And don't worry, I'll teach you all the important phrases step by step. Just listen carefully. Let's get started. Part 1. Making an appointment. Let's begin with the basics, calling the dentist or talking to the receptionist. Imagine this. You call the dentist's office. The receptionist picks up and says, "Hello, how can I help you today?" What do you say? You can use this very natural sentence. I'd like to make an appointment, please. I'd like to make an appointment, please. If you need a specific kind of appointment, say, I'd like to book a checkup. I'd like to book a cleaning. I need to see the dentist as soon as possible. Please repeat after me. I'd like to book a checkup. I'd like to book a cleaning. I need to see the dentist as soon as possible. Now, sometimes the receptionist needs more information. She may ask, "What is the appointment for?" Or, "What seems to be the problem?" What is the appointment for? What seems to be the problem? Here are simple answers. I have a toothache. I have a toothache. My tooth is sensitive to hot and cold. I think I have a cavity. I think I have a cavity. My gums are bleeding. A cavity is a small hole in your tooth caused by decay, and the toothache means your tooth hurts. You feel pain in your tooth. Now, after you explain your problem, you often need to ask about the schedule. Here are two very common questions you might ask. What days and times are available? Repeat after me. What days and times are available? When is the earliest appointment? When is the earliest appointment? Do you have anything available in the morning? Do you have anything available in the morning? Do you have anything available in the afternoon? Do you have anything after 5 p.m.? Repeat after me. Do you have anything available in the afternoon? And sometimes you need a certain day. For example, do you have anything this week? Do you have anything today? Do you have anything tomorrow? Here's another realistic situation. Maybe the receptionist offers you a time that doesn't work for you. You can say, "Sorry, I'm not available at that time." Sorry, I'm not available at that time. Do you have something earlier? Or do you have something later? Very natural and very helpful. Now let's continue the conversation. After you choose a time, the receptionist may ask, "Can I have your full name? Can I have your phone number?" Or, "Do you have insurance?" Here is how you answer. My name is Brandon. My phone number is XYZ. Yes, I have insurance. Or, no, I don't have insurance. At the end of the call, the receptionist usually says, "We'll see you on Thursday at 3 p.m. You can answer, "Great, thank you. That works for me." Or, "See you then." Now, let's repeat the important problem sentences from earlier. I have a toothache. My tooth is sensitive to hot and cold. I think I have a cavity. My gums are bleeding. Excellent. Let's go to the next part. Part 2. Describing the problem. This part is very important. You need to clearly explain what is wrong. Most people feel nervous at the dentist, and when you're nervous, it's harder to speak clearly. So, I am going to give you simple, natural sentences that dentists hear every day. Let's start with the basics. You can say, "It hurts here." My tooth hurts when I bite. The pain comes and goes. The pain is constant. My tooth is broken. My filling fell out. What is a filling? A filling is a material a dentist puts in your tooth to fix a hole and make it strong again. If it falls out, the hole is open again. So I repeat this sentence for you one more time. My filling fell out. My filling fell out. Repeat after me. It hurts here. Come on, say it. My tooth hurts when I bite. Repeat, please. The pain comes and goes. The pain comes and goes. The pain is constant. Are you repeating with me? The pain is constant. My tooth is broken. Now, here is a very common and very helpful sentence dentists love to hear. It's sensitive to hot and cold. It's sensitive to hot and cold. This sentence is powerful because it gives the dentist very important information about your tooth. Now, let's talk about pointing and describing locations. This is very common because sometimes you don't know the English word, and that's totally okay. Just point and say, "This tooth." My gums. The left side. The right side. The back tooth. The top tooth. The bottom tooth. Now, let's make your sentences longer and more natural. For example, it hurts on the left side. There's pain in the back tooth. There's pain in the back tooth. My gum hurts around this tooth. My gum hurts around this tooth. This tooth feels loose. This tooth feels strange. I think something is stuck between my teeth. The plural form for tooth is teeth. It hurts when I drink something cold. It stings a little. It feels sharp. I feel pressure here. It hurts when I chew. Okay, we have some great new vocabulary in those sentences. Let's quickly explain a few of the important words so you understand them clearly. Gum. This is the soft, pink part around your teeth. Loose. If a tooth feels loose, it moves a little when you touch it. Sting. When something stings, you feel a quick, sharp pain, almost like a small electric shock. Chew. To chew means to bite and crush food with your teeth. These are extremely common in real dental conversations. Let's also practice describing the type of pain. This helps the dentist understand your problem faster. You can say, it's a sharp pain. It's a dull pain. What is a dull pain, Brandon? A dull pain is a soft, slow pain. It's not sharp, but you still feel it in the background. It is always there. It's a throbbing pain. A throbbing pain? Yes, a throbbing pain is a pulsing pain. It feels like the pain is beating or coming in waves. It feels like pressure. It feels like something is stuck. Now I want you to repeat after me. It's a sharp pain. It's a sharp pain. Come on, repeat after me. It's a dull pain. It's a dull pain. It's a throbbing pain. It's a throbbing pain. Sometimes the dentist will ask, on a scale of 1 to 10, how bad is the pain? This is a very common question. You can answer, it's about a 5. It's around a 7. It's very strong. It's not too bad. If it's very strong, you can say, it's about a 9, or it's about a 10. If it's not too bad, you can say, it's around a 3. It's around a 2. On a scale of a 1 to 10, how bad is the pain? Okay, let's look at a few more sentences that patients often say at the dentist. These will help you describe your problem more clearly. My gums are swollen. Swollen means the gums are bigger, puffy, or inflamed. My gums are swollen. There is a bad taste in my mouth. There is a bad taste in my mouth. I have a small bump on my gum. A bump is a small raised area, like a little ball or bubble on your gum. I have a small bump on my gum. My jaw hurts when I open my mouth. My jaw hurts when I open my mouth. Repeat after me. I think this is very important that you repeat after me. Say them out loud right after me. My gums are swollen. Say it. There's a bad taste in my mouth. Repeat, please. There's a bad taste in my mouth. I have this small bump on my gum. I have a small bump on my gum. My jaw hurts when I open my mouth. Good. And remember, you don't need perfect English at the dentist. Even simple sentences like, it hurts here, or this one, or this tooth are enough when you speak clearly. Very simple, very clear, very natural. You're the best students. Okay, my friends, are you ready for the next part? Part 3, during the appointment. Now let's learn what the dentist will say to you. It's a very important part. Let's imagine you're actually sitting in the dentist's chair. The dentist walks in and her name is Sarah. She puts on her gloves, sits beside you, and begins the exam. Here are some things Sarah might say.
Bite down. This may feel a little uncomfortable. Let me know if you feel pain. You're doing great. You have a cavity. We need an X-ray. Open a little wider. Turn your head to the left. You might feel some pressure. I'm going to rinse your mouth.
Rinse means clean with water.
I'm going to rinse your mouth. I'll suction the water now.
Suction means they remove the water from your mouth with a small tube. Now, let's look at some very useful questions you can ask during your appointment. Is this going to hurt? Could you explain the procedure? A procedure means the treatment that the dentist is going to do. Procedure. Could you explain the procedure? Do I need a filling? Is this serious? How long will this take? What should I do after the treatment? Can I eat normally after this? Do I need to come back for another appointment? Should I avoid hot or cold drinks? How can I prevent this in the future? And now, to help you feel even more confident, I am going to ask Dr. Sarah to repeat those common questions that dentists often ask during an appointment. Dr. Sarah, could you please repeat them for my students?
No worries. Bite down. This may feel a little uncomfortable. Let me know if you feel pain. You're doing great. You have a cavity. We need an X-ray. Open a little wider. turn your head to the left. You might feel some pressure. I'm going to rinse your mouth. I'm going to rinse your mouth. I'll suction the water now.
These phrases will help you understand almost everything the dentist tells you during your appointment. Part 4. Treatments and Procedures. All right, now let's talk about some of the treatments you might hear during your visit. We already talked about things like a filling, a cleaning, and even an X-ray earlier, but when you're actually sitting in the chair, the dentist may mention a few other procedures as well. For example, Sarah might look at your tooth and say something like,
I think this one needs a crown.
or,
We may need to do a root canal.
a crown is something many patients hear about. It's a cap that goes over a damaged tooth to protect it. A root canal is another common treatment. It is used when the inside of a tooth is infected and the dentist needs to clean it and save the tooth. You might also hear the dentist say,
We need to do a deep cleaning.
especially if your gums are swollen or sensitive. A deep cleaning is a more detailed version of a regular cleaning, focusing on the gums. Sometimes the dentist will say,
I'm going to apply a fluoride treatment.
fluoride is a mineral that helps protect your teeth and make them stronger. And in some cases, if a tooth can't be saved, the dentist might say,
We may need to extract this tooth.
which means remove it. Now, while doing these treatments, you might hear Sarah say things like,
You will feel a little pressure.
or,
You might feel numb for a few hours.
or,
Tell me if it hurts.
or.
Hold still for me.
These are completely normal things dentists say to help the treatment go smoothly. When you understand these phrases, the whole visit becomes much easier because nothing surprises you. You know exactly what's happening and what the dentist is doing. Okay, are you ready for the last part? Let's go. Part 5. After the appointment. When the appointment is finished, the dentist will usually give you a few instructions. These are simple things you need to do after the treatment to keep your teeth safe and help everything heal properly. For example, Dr. Sarah might say something like,
Do not eat for about 30 minutes.
or
Try to avoid hot food today.
she may also remind you to brush more gently if your gums are sensitive, or she might say,
Take this medicine if you feel pain.
or
I'd like to see you again in 6 months.
now, if you want to ask a question at the end of the visit, here are 2 very natural sentences you can use. Is everything okay now? Do I need another appointment? Repeat after me. Is everything okay now? Do I need another appointment? Please repeat after me. Is everything okay now? Come on, say it. Do I need another appointment? excellent. These sentences are simple, but they help you understand exactly what the dentist wants you to do next. And they show that you care about your oral health. And that brings us to the end of today's episode. English at the dentist. Now you know how to make an appointment, describe your symptoms, understand the dentist's instructions, and communicate clearly during your visit. Remember, my friends, the key is simple. Listen, repeat, and practice. The more you say these phrases, the more natural they will feel. If you enjoyed this episode, please subscribe and leave a comment. And tell me what situation you want to learn next. English at the doctor or English at the pharmacy. Thank you so much for joining me today on the Relevant English podcast. I'm Brandon, and I'll see you on the next episode. Take care and have a wonderful day.